right, we all ready? Good afternoon. I want to thank everyone for joining us today. The recent CDC, FDA, and Western State Scientific Review Safety Council approval of the Pfizer booster for certain groups is another step forward in our fight against COVID-19. We encourage everyone eligible to get their booster, and we want to reiterate for the 12% of eligible San Diegans who have not yet received a vaccine, we still encourage everyone to get vaccinated. Our region is doing incredibly well. Our cases are down after the recent spikes. Our overall vaccination numbers in San Diego County are incredible. Almost 88% of eligible folks have been vaccinated. Almost 80% of eligible folks are fully vaccinated. These are incredibly high numbers, much higher than the state of California as a whole, certainly higher than most counties and exponentially higher than many other states. And throughout the duration of this COVID experience, protecting the integrity of our healthcare system and saving lives has been our top priority. And for San Diego County, this has resulted in fewer deaths, higher vaccination rates, and a consistent ability to maintain the integrity of our healthcare system. While you may see other states and other regions that are in crisis level care situations, San Diego County is not in that situation because of the regional effort, because of San Diegans' willingness to come together as a community to not just get vaccinated, but be safe and be careful. Our approach has been steady, strong, and effective. And this new authorization for the booster shot is another step, a continuation of that effort. The approval of Pfizer vaccine for certain groups, again, gives us another tool, and we wanted to just briefly walk through the eligibility criteria, and we have all the doctors here on hand to answer any questions, just to make sure that San Diego County residents have access to the latest information, the most updated guidance. At times it can be a little clunky or confusing with so many different entities involved. But right now the Pfizer vaccine booster shot is only available if you received the Pfizer vaccine. If shot 1 and shot 2 were Pfizer, then you are eligible if you are in certain categories to get a booster. If you initially received Moderna or Johnson & Johnson, you are not eligible for the Pfizer vaccine. And so you will have to wait for FDA, CDC, and Western State Scientific Review approval, hopefully at some point in the future for those. The CDC recommends the following groups should receive a booster shot of Pfizer. Now, this is going to be in two categories. There's a group of folks where the CDC says you should receive a booster, and then there's a second category of folks where CDC says you may receive a booster. Both groups are eligible, but they are in two categories. The CDC recommends the following groups should receive a booster shot of Pfizer if Pfizer was your original vaccine. People age 65 and older. Everyone in San Diego County 65 and older who had Pfizer as their initial vaccine should receive a booster shot. Residents age 18 years old and older who are in long-term care settings, and people aged 50 to 64 with underlying health conditions including cancer, diabetes, heart conditions, or those with a weakened immune system. Those are the categories of folks who CDC and FDA said should receive a booster. CDC recommends the following groups may receive a Pfizer vaccine, a booster shot, and are eligible. People aged 18 to 49 with underlying health conditions. People aged 18 to 64 years at increased risk of COVID exposure because of occupation or institutional setting, including first responders, educational staff, food and agricultural workers, correction workers, public transit workers, grocery store workers, and more. Those are in the group that may receive a Pfizer vaccine. If you meet these criteria and previously received your Pfizer vaccine and it has been 6 months since you completed that second Pfizer shot, then you are eligible. A full list of all of the conditions, each of the underlying health conditions, along with a full list of occupational settings, can be found on the CDC's website at cdc.gov. The second thing we wanted to share, in addition to making clear who is eligible, the second thing is where you go to get your vaccine. We are now returned to a state of normal in terms of where you go to get a vaccine. So if you think about pre-COVID, where you would have gone to get your flu shot, you might have gone to your healthcare provider, you might have gone to a local pharmacy, or if neither of those were available to you, the county would stand up some flu shot locations and you could go to one of those. During COVID and the initial rush of getting the vaccines out, we obviously upended and changed that system because we had to do so many shots so quickly. We're now returning to how it was before. And so for those folks who are eligible and want to get a booster shot, your first stop would be your healthcare, where you normally go to get your healthcare. Your doctor, your healthcare provider, reach out to them. They have vaccines available. They can schedule you and get you in. There are 254 pharmacies in San Diego County. You can reach out to a pharmacy and get a booster shot there. And if neither of those work for you, then we at the county do have a number of county-hosted vaccination sites that are available. Presently, the sites that we have available as the county-run sites are only at about 14% capacity. And so we have plenty of capacity to be able to observe more. But again, we want to encourage San Diegans who desire the booster shot, again, treat it like you would normally treat a flu shot. Check with your healthcare provider, check with the local pharmacy, CVS, drugstore, or feel free to visit one of the county-sponsored sites or county-administered sites. We have a list on our website at coronavirus-sd.com of all of the sites that are out there, the county-hosted community sites, the mobile sites, along with the pharmacies that are providing vaccines in other locations, and so you can access that. You also can visit the State My Turn site as another option for folks to be able to get their booster shot. Boosters are an incredible tool. FDA and CDC are in agreement of the utility and value that they hold. We want to reemphasize the desire for every single eligible San Diegan to consider please getting fully vaccinated. We know that is the greatest protection that can be provided, and we know it's what will help us guide our way out of that. So with that, I'm going to turn it over to Vice Chair Vargas, and then we will open it up for questions. And as you can see, we have all of our doctors here to be on hand for your questions. Vice Chair.
Thank you, Chair. Thank you, Chair. As you mentioned today, we just want to emphasize that make sure that anyone who hasn't gotten their vaccine to make sure they got it. And I do want to emphasize the South County region is fully vaccinated at 88.8%. So it's something for our South County region to be very proud of. Quiero darle las buenas tardes por estar aquí con nosotros. Estamos entrando a una nueva etapa de vacunación en el condado, que quiero agradecer primero nada que nada a nuestro equipo de trabajo por todo lo que han hecho durante esta larga campaña. La dosis de refuerzo será distribuida en la mayoría por los centros de salud y sus médicos personales. Es sumamente importante que las personas que ya puedan tener este refuerzo, que sepan que donde van a ir a sus clínicas y a sus centros de salud para poder recibirla. Es importante enfatizar que la vacuna Pfizer es la única que ha sido aprobada por el CDC para administración como refuerzo. Entonces, si tomó la vacuna de Johnson & Johnson o la otra vacuna, pues es importante que la gente sepa que solamente la vacuna de Pfizer ha sido aprobada. Ninguna otra vacuna ha sido aprobada por el momento. En cambio, si usted recibió la vacuna Pfizer hace 6 meses, ya es elegible o dependiendo de su edad o su condición. Es importante que acuda primero con su médico para que ellos le aseguren su elegibilidad. Personas de mayores de 65 años, residentes de 18 años y mayores en lugares de cuidado de salud, las personas que son de 50 a 64 años con condiciones médicas como cáncer, diabetes, condiciones del corazón y sistema inmunológico. Después podrán hacer cita al mismo con su doctor o en alguna de las farmacias que están administrando esta vacuna de refuerzo. Por último, también es importante hacer cita por medio de los sitios de internet del condado que hemos facilitado si no tiene acceso a un centro de salud, a coronavirus.sd.com. Ahí podrá encontrar información necesaria para recibir su vacuna de refuerzo. En el condado tenemos la capacidad de proveer la vacuna de refuerzo hasta 16,000 personas diarias. Actualmente nuestros centros de vacunación están operando al 12% de capacidad, por lo que pueden recibir hasta 2,100 personas si es necesario. Estoy sumamente agradecida con la colaboración que hemos tenido por parte de la comunidad, ya que tenemos los índices más altos de vacunación del estado aquí en San Diego. Y es importante reconocer que en la región sur el 88.8% de nuestra comunidad está completamente vacunado, que es muy importante mencionarlo. Así que seguimos trabajando con estos números. La recuperación equitativa pide que todas las personas, por favor, que no se han vacunado, se vacunen, porque hay que proteger a nuestros familiares, a nuestros amigos y a nuestra comunidad. Si no se han vacunado, acuérdense que la vacuna es gratis, efectiva y segura. Muchísimas gracias.
We're happy to take any questions. Paul, we'll go to Paul first. Paul, congratulations on your recent recognition. Question? Let me ask if do one of y'all know.
Thanks for that question, Paul. I think, again, to reemphasize Chair Fletcher's point that this is a great conversation to have with their primary care provider, but if it's not explicitly in those underlying medical conditions, then they would not qualify. So, thank you.
Yeah.
I was just going to, so the people who qualify now, they don't have to sign up like back in the good old days on the website. They can just show up
That's
to
exactly right.
CVS and just get the shot.
Yeah, so if you're fully vaccinated and you're in the category of either should or may, you can reach out to your healthcare provider. You can go to a pharmacy. I would call ahead and make an appointment. But anywhere, the vaccine is really widely available now at hundreds of locations. We also have plenty of supply. There's not a shortage of supply, and so there's not a shortage of appointments. So folks can go wherever they would normally go to get a vaccine or a flu shot. Try that, and then you can always go to the county website and access one of our sites as your backup. Yeah.
Do we know, is it okay to get the booster and the flu vaccine on the same day?
It is, but I'm going to have the doctor tell you that.
It's quite simple. Yes, you can get the COVID-19 vaccine as well as the flu vaccine at the same time.
And the booster?
Exactly, the booster. And if you've already been fully vaccinated for Pfizer, and it's been 2 weeks after your second dose, so that's the definition of fully vaccinated, and then 6 months after being fully vaccinated, then you can get COVID, and you can also get the flu vaccine.
Dr. Williams, question for you. What do you say to people who don't meet the criteria but still want to go and get the booster? Will there be pushback at the pharmacy, or what's your response to that?
Well, I'm going to give you the same answer that Dr. Shaw gave you. We are following the CDC and CDPH's guidelines, so we want people to adhere to those strict guidelines that have been put forward. Now, things could change in the future, but for right now, adhering to those ages for the categories that have been defined.
Hold on 1 sec. We'll go here and then we'll come back to you.
Can you repeat the question?
Yeah, we'll repeat the question. We'll come here and then we'll come back over.
Yeah, I was just going to ask a question. There is a rumor going around that if you just show up at a pharmacy, you don't need to show your card, and you can just get a booster vaccine. Do you want to clear up any confusion? Do people have to show paperwork? Do they have to show proof of being vaccinated with Pfizer ahead of time?
Well, each of the locations out there that is a healthcare setting will administer those consistent with their guidelines and how they operate. What we are saying is the CDC and FDA and Western States Scientific Review have outlined the parameters by which they have approved that booster shot, and that's what we are encouraging people to follow.
And like if I'm going to like the county site, where you could bring like my vaccination card to get like another stamp.
You would, yeah. Bring it or a copy of it so they could see it.
It's like self-attestation if you like have an underlying condition or something.
Yes, just as it has been. Remember at the beginning when we first were doing underlying health conditions, it would be much the same at county sites.
And then is there like a recommended time, like if somebody got like if they finished their 2-dose vaccine like a month ago or 6 months ago, is there a time when they should go get it?
Yeah, right at that 6 month. Once you're fully vaccinated, you're eligible 6 months after that.
So if somebody has it before 6 months, they're not eligible?
That's correct. That's correct, yeah. Paul?
Looking at the vaccine registry, you guys should be able to see how many meet criteria and are now eligible for boosters. Can you say how many that is? And second question regarding nursing homes.
Yeah.
When the first vaccination happened, you guys were going out with clinics to nursing homes
Yeah.
and assisted living. I think you were working with UCSD. Is that effort going to for a booster also going to happen?
Yeah.
when you start going out?
So I'll take the second one, and then we'll see if someone has an answer on the first one. Paul, if not, we'll get it. In the early, many of you who went through this with us, remember the tremendous effort around skilled nursing facilities in terms of going out to them. The county team has been working incredibly hard with the skilled nursing facilities throughout San Diego County, and many of them are now able to administer their own vaccine. So we can provide it to them, and they now have the capacity to be able to administer it. The ones that don't, we're working with, and we will make sure that they have someone there who can do that. At the outset, it was a very frantic process when we were doing it the first time, the speed at which we were trying to move, the uncertainty. But those relationships and that work between us and particularly those skilled nursing facilities has been ongoing. And so now a lot of them are able to administer themselves, and the ones that aren't will have more capacity to be able to get to them. I don't know if we know how many folks we think are booster eligible from the things.
So, Paul, we will get back to that, get back to you with the actual numbers. We're doing the estimation of going through that process right now. And eventually, we will be posting the percentage of individuals that receive the third dose. But the numbers are so small right now, we do not want to do that. But we will be providing that information.
Yeah. Carlos.
We had information on Wednesday. On Thursday was CDC. Thursday night and then for Friday, there was another correction from CDC. After that, now you guys are waiting for the state, for the guidelines. And there's some complications, not complications, but confusion, especially for the community. And when you guys say May, it's like somebody's gonna knock on the door to see if they open or not.
Right.
Who decides, or more or less, decide they may receive or not the booster in this case?
Yeah, it was CDC and FDA. Like that was the end result of their process. And again, in America, we have a very fragmented approach to governing bodies and healthcare. And so we have both CDC, FDA, Western States Scientific Review Council, again, as Western states that get involved in California Department of Public Health. So I certainly understand it, and watching it all kind of roll out was a little confusing, which is really why we're here today, to basically say, this is the group of individuals that, based on the current public health guidelines, should receive a booster shot of Pfizer if they're 6 months after being fully vaccinated. 65 and older, 18 and older in long-term care facilities, 50 to 64 with those underlying health conditions. But in addition to that, the public health experts are saying the following individuals may receive a booster shot, which means you're eligible for it, right? And that would be 18 to 49 with underlying health conditions, people 18 to 64 who, because of their work condition, are at greater risk. And again, those are out there. So we're just trying to provide as best we can the final recommendations and where it all ended up. Through the process, it was certainly a little clunky to observe, but we now know what it is, and we're really just here today to try and provide San Diegans with some simple information. This is who should, this is who's eligible, this is how you go get it. Yeah. Oh, hold on. Yeah. Oh, that's okay. Did you want to add?
I just want to add.
Yeah, I'm going to have Dr. Wooten add to that.
It's very important for everybody to understand that there's a process, and this same process was utilized when the Pfizer, Moderna, and J&J was approved. So first, the FDA, their advisory committee meets, and then they make recommendations on the what. And then the FDA makes that approval. Then it next goes to the advisory committee to CDC, which is the Advisory Committee on Immunization Practices. And they make recommendations on the who should get vaccinated. And then CDC approves that. And as you recall, last Friday, the CDC director basically aligned with the FDA. So that is the federal process. And then at the state level, we have the regional 4 states that their advisory committee makes that recommendation to the states. And then the state makes the recommendation, and that's what we follow here in San Diego. So that will always be the process. It's a long, as Chair Fletcher stated, kind of a clunky process, but that is the process. Thanks.
Yes.
You mentioned obviously no mass booster site set up, but is that something the county is prepared for in case the recommendations or the eligibility requirements change or say all the vaccines?
We don't speculate on what may come down the road. What I'll say is, as a region, we'll make sure we're ready to meet the need. With what we have today, with what's been approved, we're confident we're able to meet the need between healthcare, pharmacies, and existing county sites. But we will always do whatever we possibly can to meet the need. But right now, we're in a really good position with what we have. Yeah, sorry, I forgot. I didn't come right back to you.
If somebody's in one of those categories and they're eligible, so they're fully vaccinated and they had a breakthrough case, do they have antibodies where they wouldn't need the booster, or should they still get?
Yeah, they should still get the booster, but I'll let one of the docs say it.
Yeah, so, yes, they would still need the booster. So again, we'll know more as time goes on, as studies are, but yes, 90 days from their infection is when they would get the booster. So even if they had been fully vaccinated, got a breakthrough or post-vaccination infection, they would still need a booster in the future. But there haven't been specific guidelines outside of that.
A follow-up to that,
Yeah.
is there a way to find out if your vaccine is starting to wane? I mean, is there a test where you can determine how strong your antibodies are?
No, great question. That question comes up quite a bit. But the problem with antibody tests is that they're not very accurate, and we don't know what those tests mean once we get those results. So there's a lot more to your immune response than just some of the antibody tests that we do. So it's a pretty complex process. But again, that's why we're not doing the testing to see where you are. We know just by looking at the vaccine effectiveness, meaning how are we seeing infections, what are we seeing in terms of severity, and that's how the decisions are being made for boosters. So.
Matt?
If somebody's like over 65 and they're in one of those categories and they've already been fully vaccinated, they're hearing that the current vaccines still protect well without boosters, what's like the sort of case for them to get? I mean, can you sort of spell it out because their antibodies drop by 50% and they have a less response to the virus if they were to get it?
Yeah. Well, I think the simple message, and then I'll let the docs weigh in, is that same listening to your doctor, which is what led you to get fully vaccinated in the first place, still applies here. And your doctor in the medical community is recommending a booster shot. And so the fact that folks are fully vaccinated means they trust their doctor and their medical community. And that same doctor and same medical community is now recommending that they do this to provide additional protection. And so I think most folks that are fully vaccinated who are eligible will probably go out and get a booster shot because of that basic belief and trusting what the medical community is recommending to get through COVID. But let me ask if there's a specific thing. That's it.
That's it.
Okay, that's it. Yeah. Yeah.
Question to the doctors,
Yeah.
just for people who are confused, the makeup of the booster compared to the first 2 doses, what's the difference?
There is no difference between the original Pfizer and the 2 doses and the booster. So we're using the same vaccination or vaccine to boost the original vaccine, full course.
Paul?
I wonder if this booster effort is large enough to require any of the mass vaccination stuff that was done around the first round.
Well, we'll see. I mean, we think right now, that, in the outset, a lot of the problem was we didn't have the vaccine available. It hadn't gotten out into the normal things. We were getting it in inconsistent measures. We also were opening up categories of folks that were literally millions of folks, and there was that tremendous desire to get it immediately. And so with the booster, I think folks will still want to get it, but it may not be, quite as emergent in how people feel to do it. So we think that, again, between we've got a list 254 pharmacies, which are now participating. Every healthcare provider, again, that has it. Our healthcare settings are also in a different place than they were in January. Still strained and taxed, but probably a different place along with the county side. So right now where we are today, Paul, we think we're able to meet the need, but we'll assess it. One indicator will just be our county administered sites right now are at 14% capacity for vaccines. So, if we wake up tomorrow and that number is 98, then we would have to assess. But right now where we are, we think we're in a good position.
I know you guys have it in districts and boosters, like for those who are immunocompromised. Can you say how many people in San Diego County have already gotten boosters and if there's been any complications?
I don't know, Dr. Regina.
Yeah, I shared earlier that we will be providing information about who has received boosters, but right now the numbers are so small, we are not doing that for confidentiality reasons, but ultimately we will be posting that. We have the capacity to identify the 3rd shot or the booster shot. And I just want to make also one other comment about the should versus the may. Should is strongly recommended. Those are individuals that are at greatest risk. The may is based on individuals or their discussion with their doctor risk for the need for the booster shot. So the first one is very strong, And the second one, it's a may, you can get it, particularly if you think you are at greater risk. But the shoulds are the ones that we are focused on, those that are 65 years of age and older, that are in long-term care nursing facilities. And so those are the ones that we want people to really focus on. But beyond that, what we really want people to focus on is those individuals that have not had any vaccinations or have not had their full course. That's really our primary focus, in addition to boosters. Thanks.
Yep. One or two more. Yeah.
Maybe you already covered it.
That's okay.
But for those out there who have the other, like Moderna, or they have Johnson & Johnson, and there's a lot of talk about mixing and matching different kinds of shots together and how effective it is.
Not at this point.
At the end of the day, your position is this is Pfizer, only people that.
That's right.
vaccinated Pfizer.
That's right. And as the others, get further evaluated, then we'll update folks as that goes. Yep.
Just one final one for Dr. Wooten. On the booster, you said it was the same makeup as the original. Were there any tweaks made for the variants or anything?
No, it is the exact same. Maybe in the coming year, if, just like as every year we take the flu shot again, based on what's been circulating in the previous year, that could happen going forward. But for right now, today, the booster is the exact same vaccine that was utilized to administer the vaccinations initially. So that first and second dose, they're the same vaccine.
All right. Last question.
One more for
Dr.
Dr. Wood.
Wood.
You may have said this at the beginning, but if you're in that may category and you decide with your doctor that you should get the vaccine, I mean, the booster, you said you don't need a prescription from your doctor.
No, no one needs a prescription from their doctor. You can go to, if you fall into any of those categories, you can go to any of the locations that provide the vaccine. But in helping you make the decision, that's where you can make that decision yourself, or you can have that discussion with your primary care provider.
Yeah, but if you're in that May category, you're eligible.
Yeah.
And you decide you want it, you show up at a pharmacy or a healthcare provider or a county site, you're in those criteria, you'll get your booster shot. All right, thank you all for joining. Again, another step forward, booster shots. We encourage those small number of San Diegans who have not gotten their initial shot vaccine, please do. For those that are eligible for the booster, we encourage you to do that as well. And we will keep you updated on all this as we move forward. Thanks, everyone.